We provide psychiatric care and rehabilitation to almost 150 patients, both male and female, in and around Greater Manchester. The illnesses most of our patients have are schizophrenia, bipolar disorder and other psychoses, with some having complex comorbid issues such as brain injury and drug or alcohol problems. Our starting point with every patient is to determine what they can do well, which areas they wish to develop, and how we as a team are best placed to support their goals. We take a multi-professional approach using the skills of doctors, nursing staff, psychologists, occupational therapists, social workers and healthcare assistants, whilst at the same time trying to ensure that the patient can become an expert in the management of their own care. Each patient has their own individual needs and abilities that enables them to develop at a pace that suits them. Our focus is less on the traditional models of treating illness and more on seeing the patient as an individual who's got something to contribute to society. We focus on their social, psychological and spiritual needs as well as on their mental and physical health.
This place is amazing. When I came, I was welcomed with open arms.
The staff treat you with respect and dignity and everything, and they're always there for you.
They do actually care about you and support you 100%.
The staff are great. We have a laugh with them. It's like a family.
We accept referrals from a range of services. These can be from adult acute inpatient wards within Pennine Care. They could also come from local prisons or other secure hospital facilities. These may be local or at times they could be further afield. A lot of the patients have had unsuccessful discharge into the community. They've struggled to sustain independence. Once we've screened the referral, a senior nurse and a consultant psychiatrist will go and assess the patient, because we need to make sure that as a service we can meet this patient's individual needs. If we believe we can offer a service, we will aim to admit the patient as close to his home as possible so that we maintain important links with family, with friends and with community services.
We work collaboratively with our patients, exploring their strengths, aspirations and hopes, and develop individualised plans so they can start to think about a life outside of hospital. The journey for each person, however, is very different. For some, it's about supporting them to learn new skills and ways of coping. For others, it's about relearning or maintaining skills. A satisfying and fulfilling life is different for all of our patients. It might be about returning to work or mainstream education. It might be about rebuilding social networks with family and friends. It might be exploring new leisure activities or trying previously enjoyed hobbies or sports again.
I've been to Wales, Blackpool, I've started playing football again. I've got a voluntary job, I'm doing college courses at the Wellbeing College. It's just what I needed.
Over 75% of our patients who've been through the service are discharged to much more independent living, and those patients report feeling much more confident and equipped with real-life skills that can help them to manage successful discharge. The aim of the service is to return patients who've had the most severe and enduring mental illnesses back to much more fulfilling and independent lives.